I'm here at Internet of Things World in Europe with Liat Ben-Zur from Philips. Liat, you spoke early on connected and continuous healthcare. What key points did you cover in your talk?
So it's really about how can we connect healthcare in terms of time as well as in space. So throughout your entire life, you need healthcare in various different ways. You might need it in hospitals, you might need it for preventative care, you might need it when you are released from the hospital. How can we really start to connect the dots in healthcare in a much more continuous, holistic way? Only when we can start to have this type of data shared, where I can see a longitudinal view of my life, my family, my children, only then can we really make better decisions, both for ourselves, but also our doctors and professionals make better decisions with that data.
And what recommendations did you make to healthcare executives in the audience?
What I really want everyone to focus on is to start thinking much more globally in terms of an ecosystem. There's so many fantastic startups out there that are doing really cool things in health tech around very kind of niche verticals. So solving a problem just for diabetes, or solving a problem just for breast cancer, solving a problem just for a certain area. How can we start to connect those dots? If people can start to build their solutions in terms of services that can plug together, services that can talk and share data, services that can actually augment one another. That's really how we're looking to build things at Philips. We're building solutions that we're looking to work with partners, we're looking to co-create with partners. So if there's fantastic, for example, devices out there that help track children, help track babies, help mothers really understand how their babies are growing and developing, we're very eager to work with those types of partners to augment our parenting platform called YouGrow. So it's all about thinking in terms of services, open APIs, and the ability to share data and to connect these services together.
And what IoT projects is Philips working on at the moment that really excite you?
Oh, there's so many different things that we talked about on stage. We talked about things we're doing in hospitals and with big health systems like the NHS, where we're really looking to work with them to bring an ecosystem of providers together, community members together, psychiatrists together, other patients together to help people with chronic diseases, which is what we've done, for example, with the NHS in Liverpool. We talked a little bit about what we're doing with continuous care in homes with Banner in the US, where by letting people go home after they've been released from the hospital with connected devices that communicate back to hospital systems, how they've been able to reduce so much of their costs and reduce readmissions. We talked about things that we're doing with connected devices such as CPAPs that allow people with sleep apnea to have much higher compliance to their CPAP therapy when they go home. And it's really about how can you take all of these IoT devices that so many different companies are putting out there, but start to connect it up with real clinical systems, clinical expertise, so it's not just about collecting data, but what can you do with that data? How can we turn that data into better decision making? How can we turn that data into better results at lower costs? And that's really the name of the game for the future of healthcare.
Excellent. Thanks, Liat.
Thank you.